Wow, would you look at that? What happened? A guy just fell down because of his problem in his knee. That is a sports injury called runner's knee. Some people may think, what? He's not running, he's just walking. How can you call this runner's knee? True. Actually, runner's knee is a common term used to describe many different conditions that cause pain around the kneecap. As the name, running is a common cause of runner's knee, but any activity that puts stress to the knee can cause a runner's knee. Here is some common causes of runner's knee. The symptoms of runner's knee are very simple. For example, you may feel pain when walking, climbing, or descending stairs, squatting, kneeling, running, standing up, sitting down, sitting for a long time with knee bent. Relax. In most cases, runner's knee can be successfully treated without surgery. Here is a method called RICE, R-I-C-E. Rest. Avoid repetitive stress on the knee. Ice. To reduce pain and swelling, apply an ice pack or a package of frozen pins to the knee for up to 30 minutes at a time, and avoid any heat to the knee. Compression. Wrap your knee with an elastic bandage or sleeve to restrict swelling, but not too tightly as to cause swelling below the knee elevation. Place a pillow under your knee when sitting or lying down to prevent further swelling. When there is significant swelling, keep the foot elevated above the knee and the knee above the level of the heart.
So, before I start my presentation, let me talk about an experience that I would like to share with all of you. When I was a child, I loved to watch TV with my father. At that time, my favorite TV channel was called Animal World. There was a bird giving me very great impressive. The bird is called woodpecker, and by my research, woodpecker pecks wood more than 12,000 times a day, an average of 15 times per second, but it did not get concussion because it has a very hard skull, so they did not get concussion. So, what is concussion? The concussion is an occurrence transit brain function obstacle after the head suffers external force below. There are several reasons for the concussion. The first is the brain is directly hit by an external object. The second is collisions with other part of the body affect the brain. For example, when falling from a high place, although it is buttocks first, but may also react to the hand cause the concussion. So the symptoms of concussion vary depending on the level of injury. Some people may lose consciousness, but some people may not. It's divided into 3 levels, and in the grade 1, concussion symptoms last for less than 15 minutes. There is no loss of consciousness. With a grade 2 concussion, there is loss of concussion, but symptoms last longer than 15 minutes. In a grade 3 concussion, the person loses consciousness sometimes just for a few seconds. The seriousness of concussion dictates what kind of treatment you need to seek. And most of people with concussion fully recover with appropriate treatment. So let me point out some steps you need to take if you get concussion. The first is seek medical attention. A healthcare professional can decide how serious the concussion is and whether you require treatment. If you have suffered a grade 1 or grade 2 concussion, you might just take several minutes, hours, days, or a week. If you have sustained a grade 3 concussion, see a doctor immediately for observation and treatment. The doctor may also ask you simple questions such as where do you live? What is your name? Who is the president? The doctor asks this question to evaluate your memory and concentration skills. The second is take a break. Minimize the chance of having a second concussion. And how can I prevent concussion? The first is wear protective equipment when you do high-risk sports such as football, hockey, and soccer. And the second is drive and ride smart, because we always need to wear
Seat belt.
And we need to obey the posted speed limit and don't use drug or alcohol because they can impair reaction time. Let's start with runner's knee. 1, 2, 3, 4.
Water the itch if you use your knees. What are the symptoms? It's a pain around the kneecap where you may feel pain. Walking and climbing. What is the treatment I'm going to show you?
Rest, ice, compression, and please do not forget elevation. Rest, ice, compression, and please do not forget elevation. Yeah, you can really solve it. Let's talk about concussion. 1, 2, 3, 4.
What is concussion? It's a brain injury. What are the symptoms? It depends on the level. Some loss of mind, but some people don't. What is the treatment? Restrict mental activities.
Careful, careful, be careful. Headaches and vertigo's a complication. Careful, careful, be careful. Go to hospital and check instantly.